You're going about your day, you're with your family, you're out shopping, and you're doing well, everything's great. You have diabetes, you're a little bit overweight, you've been prescribed this wonderful drug by your physician, and all of a sudden you can't see what's going on. Your family rushes you to the emergency room, and you've lost vision in one eye, and the other eye is blurry. You've been on this new drug, this wonderful drug that's controlled your diabetes and helped you lose weight, and all of a sudden you've lost your vision. What's going on? That's what we're going to talk about today.
An increased risk of developing an eye condition that can cause irreversible vision loss. The author's saying, however, that more studies are needed to confirm a link. Join us now, Dr. Scott Gottlieb, former FDA commissioner and a CNBC contributor. What do you know about this, doctor? And I assume it's so widely used now, we would know if it was any type of significant percentage as far as a risk. But I mean, even a slight risk of something like that seems like it's something that we need to talk about or think about.
I think that's right, Joe. I think if this was very prevalent, we would see it, given this population of patients now on these drugs. This was a well-done study by a group of physicians at Massachusetts Ioneer. They had observed anecdotal reports of this condition, non-arteritic anterior ischemic optic neuropathy, in patients who were on the drug, and then decided to go back and look at the hospital's records to see whether or not there was a correlation between patients who were taking these drugs and a higher incidence of this this really devastating side effect where you get ischemia to the optic nerve, and it could cause temporary or permanent blindness. And they did find an increased incidence of the condition in patients who were prescribed the drug either for diabetes or obesity. That doesn't establish a causal relationship. They're going to need to do better studies now going forward, and I think this is going to trigger further investigations. And there's also a randomized study underway by Novo looking at whether or not there's an association between diabetic retinopathy and these drugs. And so that study is probably going to be amended to look for this side effect as well, I would imagine. So there's going to be a lot of investigations going forward. I think regulators are going to get to the bottom of this. I'm sure they're looking at this study. But it's certainly intriguing, and I think it certainly merits further follow-up given the care that these physicians took in doing this retrospective study. It is a little perplexing because these drugs are thought to protect against inflammation and be neuroprotective, and so it's perplexing what the exact mechanism would be. But we do know that vision disturbances are already in the labels of these drugs. When you get rapid correction in metabolic parameters, and particularly blood glucose, that can cause visual changes. And there's also been suggestions that there's a correlation with diabetic retinopathy, which with potentiating that condition as well. So we already knew that there was some association between these drugs and visual disturbance, just not this condition.
So there you have it. Recently on a news report, it's all over the internet, this new side effect with a drug we all know, Ozempic, and of course its sister drug, Wegovy. They both have the same active ingredient, semaglutide. And what I'd like to do is share with you more information about this new side effect and talk to you a little bit about not only these two drugs, but similar drugs. And I'd like to share some important information that you should know because I don't think that there's a lot of information coming out, and I don't think the public is being warned adequately. And I think we need to understand what's behind these findings. So essentially what we're dealing with is an association between individuals who took this active ingredient, semaglutide, for either weight loss or diabetes control or both, and the increased incidence of this condition that they refer to as non-arteritic anterior neuropathy. And so it's an optic nerve neuropathy, and it's painless. So essentially, the findings of this organization was that Ozempic and Wegovy associated with semaglutide was associated with this non-arteritic anterior ischemic optic neuropathy, referred to as NAION. And essentially, it's the damage to the optic nerve. Now, they don't have a full understanding of this condition. In fact, this condition has been described long before this drug association. NAION's been described. And of course, people who are at risk for this condition are people who have diabetes and who are obese. Other things such as ischemia, inflammatory disease, high blood pressure, certain medications may predispose you to this. So this is a condition that was known to be prevalent in this population already. But what is NAION and what should you know about it? Again, it's associated increased risk, or there's an increased association of this condition if you're taking semaglutide. However, you're not taking semaglutide and you have, if you're overweight and are diabetic, you're at risk for this condition anyway. It's a sudden onset of blurred vision, a color disturbance, distortion. You can have loss of peripheral vision. You have loss of contrast, light sensitivity, or just overt blindness. It can be mild, it can be severe, but frequently for most people, it's non-reversible and there's no cure. That's one thing to remember. Now, as they pointed out in the news story, there's already a known association with increased or worsening diabetic retinopathy with semaglutide and other related drugs. However, this condition can be temporary and is typically reversible. This condition, NAION, is not reversible, and it's a much more significant abnormalities. Now, what have they come out and recommended? I looked at some of the articles online. This is the gist of what they say in terms of implications for patients. They say at this time, we do not recommend people stop taking semaglutide. Now, I'm going to make a comment on this later in terms of what my thoughts are regarding this. They say if you take semaglutide and you have sudden vision loss, then stop taking the drug immediately and see stop taking the drug and see your doctor immediately. Well, duh. Some people are also concerned about other diabetes drugs such as Mounjaro or similar drugs to semaglutide. This study only looked at semaglutide. However, the concern for other drugs is an important one because these drugs have similar mechanism of action, and this potential side effect could be a class action side effect. So they also say patients should talk to a primary care physician to determine if semaglutide is right for them, and that's always the case. Let's take a look at the data. So I actually pulled the abstract of this study, and I want to point some things out to you that I think is very, very important. I don't think you'll get this from the news media. This abstract, as they pointed out in the story, was based on some anecdotal experience. So essentially what that means is some physicians who were seeing patients treated with this drug noticed that, or at least it appeared to them that they had more people coming in with this condition, NAION, who were on the drug than who were not. So that's a clinical observation. You can't make a lot out of that, but you have to raise a question, and it's important to raise questions when you see something clinically. And so in this institution where they treat this condition regularly, they had the opportunity to go back and look at a large database of patients over a 3-year period. So that's what you have, what's called a retrospective, a look back at matched data. So they looked in a database at patients being treated either with this semaglutide or with some other diabetic agent drug. And they looked for a period of 3 years. They looked at the patients coming in over a 3-year period of time. Over a 6-year period of time, almost. And they pulled data from there. About almost 17,000 patients were seen. And they looked at prescriptions for semaglutide versus any non-GLP-1 receptor agonist medication. So the reason I say this could be a class effect, they didn't compare it to other GLP-1 agonists plus non-agonists, but they compared it only to non-GLP-1 agonists. So you cannot exclude the possibility that people who are on another type of GLP-1 receptor agonist will not be predisposed in a similar fashion. What did they find? Well, first of all, they looked for the incidence, which is the prevalence, the amount, the amount of disease in that population. And they looked at what's called the hazard ratio. The hazard ratio is the chance of getting this condition if you have the drug compared to if you don't have the drug. So let's say, for instance, if you have someone getting this drug and then a group not getting your drug, and let's say the hazard ratio is 2, then you can say there's a double the chance. You have a twice the chance of getting this condition on the drug than off the drug. If the hazard ratio is 3, you have a 3 times chance of getting this condition than off. So what did they find? Well, among the population of people being treated for type 2 diabetes, they saw an incidence of about almost 9%. So about 9 out of 100 individuals in the population had this condition compared to about 2. So people not getting this drug, roughly 2 out of 100 compared to 9 out of 100 who were getting the drug. So much significant increase in incidence. How about the ratio, the hazard ratio? Well, they found there was a 4.3%, a 4.3 times chance. You have greater than 4 times the chance of getting this NAION if you were taking the semaglutide than if you were not. So greater than 4 times chance of getting it. If you're being treated for obesity and overweight, they found an incidence of about 6.7%. So 6.7 out of 100 people compared to less than 1 out of 100 had this. So you had almost 7 out of 100 people had this condition who were being treated for overweight, had this blindness, and you had almost about a 6.7 times, so almost an 8 times chance of getting blindness on this drug if you're being treated for being overweight. So over 4 times if you're being treated for diabetes, nearly 8 times risk if you're being treated for being obese and overweight. So if we look at the data analysis, as I pointed out, it was clinical observations. There was a look back on the clinical data. That's what retrospective means. It was controlled, so they did standardize the populations. The population and study characteristics, there were people with diabetes and who were treated for diabetes, and treated for overweight and obesity. It was semaglutide versus a non-GLP-1. Now, here's the kicker. The population that was looked at in this group had 36 months exposure. I want you to put a pin in that because that's an important differential that we're going to point out between this study and other studies we're going to talk about. For diabetics, they had a 7% greater incidence of blindness if they were on it, a 4.3 times increased risk for diabetics. And for people obese and overweight, that is 6% greater incidence and a 7.6 times increased risk of being on semaglutide. So what's my analysis? What are my thoughts? First and foremost, most studies with the SGLT1 agonists range from 6 to 18 months. Why is that important? I pointed out that this population was exposed for 36 months. So the point is simply this. If you have a study of a drug and you look at that drug over 6 months to a year and a half, you're not exposing that population long enough to bring other symptoms. Any drug, and I've said this on other talks, over time, if you look at a drug for 2 years, okay, you may see a certain set of side effects, but that may not be every side effect you see. If you extend that time duration to 5 years, you're going to find other side effects. You extend it to 10 years, you're going to find other adverse effects. We know even in clinical observation that drugs have increased adverse effects over time. So in my opinion, it's not surprising that you could find another adverse effect on this drug if you just give a longer time exposure. So the population that they looked at were exposed to this treatment for 36 months compared to the trials. For the most part, they were exposed to only 18 months. The cumulative incidence hazard ratio were very significant in both groups. So these were very significant findings. So we can't exclude other SGLT1 agonists because it could be a class side effect. And so, in my opinion, these drugs should be pulled from the market until further analyses can be made, largely because a time duration effect is very possible. And what we're seeing here is possible evidence that you're having this more lethal, I should say not lethal, but more devastating adverse effect after 3 years. So what could you find after, say, 4 years or 5 years or 6 years? And it's recommended that these drugs be used for life, because we know that when you use these drugs and once you stop them, all the benefits of the drugs are lost. And so people regain their weight, the diabetes become less controlled. So these drugs are generally recommended to be used for life. However, we don't have safety data for more than 18 months. And we're having some evidence that there may be some other abnormal problems up to 36 months. So we should remember clinical trials are done for limited periods of time. We shouldn't recommend these drugs beyond the time period. I make that argument for statins. I make it for antihypertensive drugs. Drugs are meant for a limited period of time. For a finite period of time, you have to find other more permanent means. Now, there's some exceptions. People have certain conditions, certain drugs you have to take for a prolonged period of time. I won't get into those details, but for the most part, most chronic illnesses that are treated with drugs, you should look at lifestyle and other alternative approaches of allowing the body to heal itself, as opposed to recommending lifelong medications. It's very likely that medications have increased number of adverse events over time. I said that. In this case, NAION was not seen in 6 to 18 months significant in the studies. However, patients exposed over 36 months showed a significant incidence. And yes, a prospective study needs to be done. You can't control a retrospective analysis as well as you can a prospective analysis, but I think these differences were very striking and they're very telling. And in my opinion, they're telling enough to say, let's put a pause on these medications until we find out more. We need to do studies over, say, 5, 6, 7 years, maybe 10 years, to get a better handle on the potential long-term side effects in patients with these conditions. Again, more work needs to be done. Now, just for your information, there are drugs similar to Ozempic. You may know these other drugs. These are all GLP-1 agonists. And so I'm not saying that these drugs have the same side effect. These drugs have not been studied and looked at NAION, but these are drugs that are similar to Ozempic. Here's a reference, and you can find the package insert of this drug and other medication online. I put this up here to point out the fact that you should always just go online, Google, say, whatever drug you take in package insert, look here and you see what other type of side effects. You have warnings, precaution, pancreatitis, diabetic retinopathy, hyperglycemia, acute kidney injury. So these are some other side effects of this drug, as well as drugs that are similar to it. The indication of type 2 diabetes and weight loss, as we all know. But what are my thoughts? What are some alternatives? I've given a talk on this before. The next few slides I'm not going to spend too much time on, but I want to share this information with you. So how does diet work in drugs? So we actually did our own study looking at a defined plant-based diet in our clinical population. We looked at patients who were obese, who had high blood pressure, elevated cholesterol. So these were not diabetics. We looked at the effects of this defined plant-based diet on hemoglobin A1C, and we saw a very significant reduction in about just 4 weeks. So this was a very significant, about a 3.4% reduction of hemoglobin A1C. We saw a reduction in C-reactive protein. We saw a very significant weight loss in just 4 weeks, about 5 to 6% weight loss. Waist circumference also went down significantly. And when we extrapolate our data over 4 weeks and compare it to what you would get with these drugs, Ozempic or Mounjaro, we saw that you saw much more rapid weight loss with the diet, as indicated by the blue line, compared with the drug, which is much slower in the first 4 weeks. You have the same thing with Mounjaro, a much more rapid weight loss, much more rapid A1C reduction compared to here. A defined plant-based diet had a 1.7% weight reduction per week. That was about 4 to 7 times more effective than the drugs. And so essentially what you're dealing with here is, if you choose a more definitive lifestyle approach, you'll get success. And not only you get success, but you'll get it more effectively, more rapidly, and you don't put your body at risk for these side effects. and we coach our patients on these things a lot. So I hope this was very helpful to you, because it's very important that we are aware of these adverse effects. You see the commercials, and the commercials talk about the side effects that are in the current labeling, but there are new things that are being seen all the time. They do make it to the news, but it makes it to the news in a rather hush-hush manner, and this is something we should all be aware of. I don't agree with the sentiment to continue the drug. I think this is enough information for them to go to the pharmaceutical industry and have them discontinue this medication until more data is found out. So I hope this is helpful to you. If you're new to this channel, hit the subscribe button and also the notification bell. And of course, please give us a thumbs up to help with the YouTube algorithm. And please share this important information to anyone and everyone that you think it could be of benefit to. Until next time, take care.